This is Something to Talk About from the Bainbridge Island Senior Community Center. And today we're going to learn about the state of the sectors, of the areas that are human services and arts areas of interest to the Bainbridge Community Foundation and to all of us. Dana Binnendijk from Bainbridge Community Foundation is with us. And I'd like to thank Fieldstone Communities of Bainbridge Island for sponsoring these programs. We do them Monday, Wednesday, and Friday, and sometimes other times as well. So check out the calendar on our website to see what might be coming up. Fieldstone offers innovative and compassionate care as well as day stay and respite programs. To learn more, call 360-689-4314. Dana, thank you very much for joining us today. I know that you've been giving this talk a fair amount, letting people know about this, but it's really important work that BCF has done, and I feel like we can't share it enough.
Thank you. Can I take it away?
Yeah, so you're involved in community engagement at BCF?
Yes, I'm the Community Impact Officer is my official title here, and I work on communications primarily, a lot of these reports, as well as programming, so training programs. Okay,
and so you were involved in putting this report together this year, I'm imagining.
Yes, very much so.
And so I know that you put together a little presentation. You can certainly share your screen, but I'm interested in you sharing with us some of your findings. Not all of them. I know there'll be more than we can get to in the time we have.
Yes. Thank you. I am happy to share. I sort of broke it up. I broke the report up into a couple of pieces for the presentation. So I'm happy to kind of stop halfway through to take questions or see how people are feeling, and we can talk, kind of feel it out from there. So the first half will really focus more on the findings and some of the analysis that we did, and the second half is really sort of more focused on nonprofits in particular. So we'll start with the analysis, see how that's going, and if people have questions, we can go from there. We always like to start our presentations acknowledging that we are in Suquamish territory. So I'll read the land acknowledgement. Chief Seattle said, "Every part of this soil is sacred in the estimation of my people. Every hillside, every valley, every plain and grove has been hallowed by some sad or happy event and days long vanished." We would like to begin by acknowledging that the land on which most of us gather is within the Aboriginal territory of the Suquamish people, the people of clear saltwater. Expert fishermen, canoe builders, and basket weavers, the Suquamish live in harmony with the lands and waterways along Washington's Central Salish Sea, as they have for thousands of years. Here, the Suquamish live and protect the land and waters of their ancestors for future generations, as promised by the Point Elliott Treaty of 1855. I just wanted to give a quick snapshot of what BCF does. We do data collection and analysis. That's kind of what we're going to be talking about today. But in addition to that, we do educational programs, grant making, stewardship of donors, so connecting donors with nonprofits. We hold donor advised funds, and we try to build connections between nonprofits as well. And last year we celebrated our 20th anniversary, our official 20th anniversary. We've been around since the 1970s as a volunteer organization, but we are officially recognized in 2001 as Bainbridge Community Foundation. So with that, I just wanted to share a couple of numbers. This was last year's data. We want to update it sort of as we get towards the end of this year, but essentially in 2021 alone, we awarded 586 grants back to the community, which totaled more than 2.2 million just in that 1 year of 2021. And since inception, as of the end of last year, we awarded more than $19 million in grants. So that's since 2001. It's definitely gone up this year already quite a bit. So I would imagine that number is going to be rising towards the end of this year. So really just about the state of the sector report, I think the big idea behind this report to share is that we have been doing an annual survey for the last 10 years and have produced this report for the last 2 years. And we really use the data from that annual survey that we provide, or that we give, and use that data to create this report. And this last year we had 57 nonprofits respond to that survey. And we also have sector gatherings afterwards to talk about some of the findings. So the idea behind this report is essentially to provide, it's just a starting point for nonprofits or for those in the community who want to engage further. So quick overview of our islands. We have 24,825 people on the island. Our population growth is a little slower than the rest of Kitsap County. On the island itself, we've had 7.8% growth in the last 10 years. This is due according to 2020 census data, so I imagine that's gone up a bit in the last 2 years. We are 52% female, 48% male. Our average age is 50 years old versus 38 years nationwide. Racial makeup is 85% white, with a variety of percentages in other areas, with 2 or more races at 9%. The notable change in this from last year is that last year it recorded that we were 90% white and only 5% 2 or more races. And that has steadily increased since last year's report. And that could be for a variety of reasons that we'd be happy to discuss, but a notable data point. Highest educational attainment, big takeaway from this is that we are a highly educated community here. So on to the community challenges and opportunities, I would say, but we will sort of focus on some of the challenges here. I think the opportunities really lie in a lot of the work that the nonprofits are doing to address some of these challenges. So big chart here. I'm going to try to explain this so it's a little bit easier to understand. The big chart here essentially is trying to identify some of the challenges from the perspective of our nonprofits. So when you look at the line represents data from last year's survey, which is really looking at 2020. Because the question was, what are the challenges facing our community last year? So the line represents really sort of first year of COVID. What are the challenges that nonprofits see our community facing? The bars are really representing this year's survey, which are talking about last year. So the top 4 challenges that we really saw were isolation, both years, mental health challenges, both years, family economic uncertainty as 3rd, and food insecurity as 4th. You can see that food insecurity between the 2 years, it was a little bit less of a challenge last year, but as we were talking to nonprofits, it really became clear that was because federal assistance ran out.
So right, that was temporary. So yeah, we had some help, and that help is not as present as it was.
Exactly, and I think that's where I think if we ask that question again now, it might be different. It might have gone up. So, so we can summarize that kind of in 2 areas: affordability and mental health. And you can see on the side, we provided a couple of examples of projects that nonprofits or projects that BCF has supported that address these issues directly. I do want to mention too that there are nonprofits in other sectors that address these 2 areas, perhaps a little bit more indirectly, but still having a pretty strong impact. So an example might be that there might be a performing arts nonprofit that provides free programming to folks who might not be able to afford the programming normally. And I think that also has an impact on mental health to be able to go to cultural performances. So all of our nonprofits really touch on these 2 areas, and that's really one of the things that we wanted to emphasize. So doing this, we took a deep dive into both affordability and mental health. So we'll look at affordability. Oh, and before I do that, I wanted to mention too that we did some cross-checking of data. This is the 2020 Communities Assessment that found sort of their top 3 findings were very similar to ours. So we wanted to make sure that we had done our research and weren't totally off in our findings, and it looks like a lot of them are aligned. So a quick look at affordability. Average home price on Bainbridge Island. There are a lot of different data points out there in terms of price of housing, but we use Zillow consistently. So it's, according to this resource, up 150% since 2014 on Bainbridge Island, compared to when you look at the same resource, 85% nationwide during that same period. So the price increases on our island has increased at a much faster rate than across the country. We put together this graph. It's hard to follow completely, so I'll try to explain it a little bit, but essentially the big picture here is that there are 30% of island residents in North Kitsap residents more broadly, who are probably having a little trouble making ends meet. And that is essentially because when you look at something called the self-sufficiency standard, which was defined by University of Washington as the amount it takes for a family of a certain number to live within a community, a family of 4 living in North Kitsap needs to make at least $78,752 household income. And when you look at what our data points are on the island, 30% of people living here are making less than that in terms of household income. So there are definitely, if you look at the federal poverty rate, it's a lot less because that uses nationwide data. But when you look specifically at our community, the affordability is a little bit more challenging. Should I just keep going, Reed? Do you have any questions? Should we stop for questions? Do you want me to keep going?
Well, if anybody has anything that they would like to ask right now about this, I think that the idea of, although $78,000 sounds like a big number when you start to think about both the cost of services here and the distance that it takes to get to places, and the fact that people need to have things like transportation arranged, or they have to provide it themselves. All of those things play into what it takes to live on a place like Bainbridge Island. So it makes sense to me.
Yeah, and I would actually say that number might be a bit low now, because these are numbers that came from a 2020 report. And as we all know, even just observing around us, the last 2 years have seen a pretty steep increase in prices. So I would say, since there's a data lag, I would say that number has probably increased over the last couple of years.
Right. And when you look at what the cost to rent something on Bainbridge has been and has continued to grow, you see that housing can be a real big part of that. And of course, many of you on this call know that. If you have a question or a comment, you can always just press the reactions button, and I'll keep an eye out and call on you.
Thank you. Thank you. And we look at salaries too. I think one of the areas that we asked during the survey, you can see the numbers that we kind of already discussed here. But one of the things that stuck out for us in the survey is we asked how many nonprofits are able to pay their staff more than $64,190. And 78% of nonprofit staff make less than that amount. And that's the amount of the Kitsap County area median income at the time of the survey. In February, that's increased with the latest census data that came out later in the spring. But 78% of nonprofit staff make less than that annual amount. So I think that's important to note when we're thinking about affordability and the importance of our nonprofit community on the island and beyond. One of the other areas too, this is a snapshot of how inflation affects affordability as well. Don't need to look at the details other than the fact that the red line is essentially accounting for after inflation. And this is looking at hourly earnings. So when you adjust, even though hourly rates have gone up a lot in the last couple of years, inflation can kind of cancel out some of those gains. And that's something that we, especially these days as the news is coming out about inflation, can be a concern. And again, here, this is just a snapshot. Last year's report, the 2021 report, we looked at vulnerable groups. We took a look at youth, we took a look at seniors, and we took a look at women, and particularly single women with children appear to be one of the most vulnerable groups, considering that on the left, you can see that women make generally less salaries than men. And on the right, you can see that women with children tend to be the higher group of living in poverty by family type.
So these are statewide numbers?
I should mention that these are statewide numbers, yeah. And definitely not exclusive of our community in the sense that, knowing that affordability is so high here, that it's getting harder for women, single women with children in particular. And so we'll shift to mental health, and I promise this is not going to all be bad, terrible news. We have there are support systems here, but it's important to look into these challenges, I think, as well as acknowledge that they're there. So mental health, shifting to this, these are pandemic related numbers, and this is nationwide. So this is not just our community, this is across our country. These are numbers from CDC, and essentially they have surveyed, it was over 68,000 people in our country. It's the percentage of adults reporting symptoms of anxiety or depressive disorder. So before the pandemic in 2019, that number was about 11%. When you look at sort of deep into the pandemic in January 2021, that number jumped to 41%. And that's for a variety of reasons. People who were concerned about the pandemic, just in terms of anxiety about getting sick, people who lost a family member or loved one, social isolation. Some people might have felt more comfortable reporting on mental health concerns. So there are a lot of reasons for these numbers to be this way. I think it's probably all of the above, but quite a big jump regardless in reporting of those numbers. So when you break it down, we actually made this graph based on data from the same source, where it's broken down from between male and female, and it breaks it between anxiety and depression, which are two different issues. So you can see the solid orange line here is really female anxiety, and that tends to be higher than even female depression and male anxiety and male depression. So that the women across the country tended to have more anxiety than any of the other areas. And what's interesting is if you sort of drew a line, between these, this is over the course of COVID. So it started collecting data when it was already pretty high because COVID had begun. When you look at the various, we added these events to the graph because I think it's important to note that the news about the pandemic really did make an impact on people's mental health. So when you look at July 2020, you can see that there was a drop in reporting of mental health concerns. People seemed relieved, so to speak, that there had been a sign of producing a vaccine, but it's still, since the vaccine hadn't come out yet and there were some controversies around it, mental health concerns continued to rise. Finally, emergency use authorization of vaccine came about. Some of the reporting declined, so there were some positive trends in that way. And then it kind of evened out. And a lot of we're definitely not at the pre-pandemic numbers of mental health. A lot of the resources and sources that we have, that we looked through when writing this report, found that, historically when pandemics hit, it can take a long time. There's a lag to get back to the original mental health pre-pandemic numbers. Some sources said 2 to 3 years, some sources said 7 to 10. So it can be a while before there's a full recovery. My personal experience would mirror that for sure. I think a lot of ours. And we're still feeling it, right? I mean, I think that's the reality, is that there's a lot of relief having come from the vaccines and from lighter versions of the virus, but there definitely remains concerns around it. So we looked a little bit at these. I should have probably made the title a little bit clearer here, but these are the next couple of slides are going to be focused on Bainbridge specific statistics. These are results from the Healthy Youth Survey, which is given statewide, Washington State, and it's given to students of middle and high school. And essentially, they look at the physical, mental, emotional health of students across the state. And you can break it down by county, and then you can also break it down by even just Bainbridge Island School District itself. So these numbers here are looking at Bainbridge Island School District specifically. And what's interesting here is you're looking at, we're comparing 2019 numbers to 2021, so pre-pandemic to sort of midst of the pandemic. Depression rates definitely did increase across the board. Anxiety dropped for 10th grade, which was sort of interesting, not by a huge amount, only 2%, but did drop in 10th grade between 2019 and 2021, and then increased for 12th grade fairly significantly, 5% or so. When you take those numbers and compare them to statewide data, these are numbers essentially looking at Bainbridge. So the orange is Bainbridge Island School District. And these are all results from this year's survey, or the most recent survey. I think it was given the end of last year. But the orange is Bainbridge Island School District, and red are the state results. And this pattern actually follows previous years. We looked back at previous data, and what's interesting is that the depression rates, or feeling sad and hopeless, are much lower on Bainbridge Island than they are across the state. But anxiety levels on Bainbridge Island is higher than the statewide. And that mirrors previous years. So an interesting observation that depression rates are lower on our island compared to the rest of the state, but anxiety levels are higher. In good news, we have extraordinarily hopeful youth in our community. This was a question that was added this last round of the Healthy Youth Survey. They did not ask this previously, so we don't have data from previous years. But what's good about this is Bainbridge Island youth in particular. I think this is 12th grade at Bainbridge High School. And there's a lot of hope. So 62% that they said that they were highly hopeful, 25% said moderately hopeful, only 12% said slightly hopeful, and 1% said no or very little hope. So while I do worry about those 1%, it's a good result that there's essentially a lot of forward thinking, and it's usually positive.
It seems like there may be a connection between that hope index and the depression index. It seems like those things might go together. Yeah. Anxiety is a different
animal. Yeah. And differentiating between the two is interesting, because they are different animals. I guess I'll stop here. I don't know. I mean, I guess we can keep asking questions along the way. I don't know if we want to stop here, Reed, or if we could talk a little bit about the role of nonprofits. What do you?
Well, I would just say that to me, one of the things that it seems to me has become evident not only here on the island during COVID, but probably across the country generally, is that we have a pretty heavy reliance on nonprofit organizations to meet some of these needs. The other places in the world may depend more on government subsidies and government-supported social workers. A lot of those people here are volunteers or work with nonprofit organizations. Is that your finding?
Absolutely, yeah. I think the report itself has a direct tie between some of these challenges and what nonprofits are doing to help address them. And I think, I'll pull up, I can talk a little bit about some of these, but I'll pull this up real quick because this was one of the findings in our nonprofit survey this past year that we gave, that we had 57 nonprofits answer the survey. I think only a couple skipped this question. For every single nonprofit that answered this question, all served lower income in some capacity, and that's across all sectors. So, 100% of the nonprofits who answered this question serve lower income in some capacity. Fewer serve, not all of them serve upper income. So those would probably be the nonprofits who are in this area, probably are the ones that provide food banks, direct human services support. But I think, being able to provide accessibility to the programs and services and the quality of life that we all have here, our nonprofits definitely play a huge role in that. So, should I keep going with some of the findings?
Yes, Nancy is just noting that isolation is even a bigger issue than other mental health. Is isolation a bigger issue than other mental health or economic concerns?
No, it is. But what remedies?
Yeah, and I'll pull this chart up again because I think I mean, isolation was the top rated both years in terms of concerns. And again, I will preface this by saying that this was a survey given to nonprofits, not the general public, but I think nonprofits work very closely with our community members, and they identified isolation as being top concern both years. So that sounds about right.
So yeah, go ahead, Nancy.
Well, my question is, what sorts of things has BCF found that can ameliorate that situation? Because you guys tap into all kinds of services.
We do, and I think, I think what I can talk about there is, we essentially provide support to. I can talk about our community grant cycle because that's the one that's the easiest to break down. We have 50% of the nonprofits that apply to our community grant cycle are health, housing, and human services. So that essentially means those are the nonprofits that are directly working on some affordability challenges, mental health challenges. So for example, Bainbridge Youth Services applied this year for a grant through our community grant cycle to support youth mental health services. And we were able to, you can apply, these nonprofits can apply for up to $10,000. But there was such enthusiasm about BYS and the work they're doing and the challenges in that age group in particular, that we were able to grant $24,000 to them this grant cycle through a catalyst, what we call our inaugural Catalyst Award, which is a nonprofit really dealing with some of the core issues in our community. So we were able to give grants to, we can give grants such as that to nonprofits who are working directly on those issues.
Yeah, but see, isolation to me is a senior issue more than it is a youth services issue. So, I could be wrong, but we are the senior center, so that's where that's where my brain is going.
Yes, in the last cycle, not this time, but BYS has helped with efforts that we've tried to do in terms of outreach. We actually asked for some help this time in electrifying the bus so that we could use less energy and be more climate conscious. But so that didn't directly affect, but it kind of gets to what Dana's talking about, secondary effects. If it becomes less costly to run the bus, then we can do more picking up and transporting the people to events and do more outreach with programs. We had 50 people take trips at the senior center to both shopping and lunches and history trips in August, thanks to the use of that bus. So that's an example of secondary effects that might not look like mental health, but are. And I know that both the Senior Center and Island Volunteer Caregivers have worked hard to do outreach with phone calls, direct phone calls to seniors over the COVID period. So that's an example of trying to ascertain the quality of health and try to connect with people to respond to either depression or anxiety.
Yeah, thank you, Reed. That's great. And this is a previous grant as well. Reed gave the example of this year's grant cycle. I think this might have been the previous grant cycle where we provided support to make spaces accessible for the hearing impaired. So again, not a direct focus on isolation. However, it definitely is supporting the Senior Center in their efforts. And as Reed mentioned, Island Volunteer Caregivers works directly in that area as well. We also give grants to Island Volunteer Caregivers, and they have programs specifically targeting isolation, and we have supported those programs as well through the community grant cycle. And I'd be happy to pull up an example if you're curious. But that's, so both of those nonprofits work very well together, and I think are focusing on that specific issue.
Thank you. Okay, thank you.
But that isn't to say, Nancy, there isn't more that can be done.
No,
the issue,
there's always room for more.
Oh, I know.
Yeah. All right. So, Reed, what do you think? Should we keep? I have a couple more findings I think that are interesting that I'd be happy to share, and then we can keep taking questions. Does that sound?
Yeah, sounds great.
I'm going to jump around a little bit here because I think this is an interesting data point it's a little hard to read, so I apologize for the small writing, and I'd be happy to send an actual report to anyone who's interested.
And how would they get a report sent to them?
Just email me and I can send it to your house.
Okay, it's Dana
at bainbridgecf.org.
Bainbridgecf.org.
Yep. And so this is a spread in that report, and don't worry about reading it right now because I think it's too small, but essentially the big picture is there's a national citizen survey. This was from 2017, and there's a new one coming. It just hasn't been released yet. Essentially identifying the positive characteristics of Bainbridge Island from the eyes of Bainbridge Bainbridge Island citizens or community members. And essentially education is rated very highly, recreational opportunities are rated very highly, natural environment is rated highly, but what was rated low was affordable quality housing and cost of living. Only 12% of people rated affordable quality housing as positive, and only 16% said cost of living is positive. So there's definitely some concerns around affordability in those areas. And I listed in the report the nonprofits that work in those areas. So, or I should say we listed it under there. So you can take a look when you receive the report if interested to see which nonprofits are working in each of those areas. Reed, did you have a question?
No, I guess I'm asking, okay, you said that this, who did the survey that the percentages came from?
It's the National Citizens Survey. I think it's the city of Bainbridge Island that produced it. I have to go back and look exactly.
Okay.
But it's a National Citizens Survey. Gosh, yeah, I'll have to go back and look exactly who the original source is. I'm happy to send that out after.
Okay, and Rita?
Yeah, I was wondering, I was looking at this affordable quality housing, and I see Housing Resources Bainbridge, but I also see Parkview Services.
Mm-hmm.
I haven't ever heard of that. Can you tell me what that is?
They're a Kitsap County nonprofit, and they also work on affordable housing issues, advocacy and whatnot. But it's they're broader Kitsap County, whereas Housing Resources Bainbridge is specifically focused on Bainbridge Island.
Right, right, and that is, I think, one of the things that for affordable rental senior housing, smaller units, is a huge, huge issue.
Yeah.
And I know it is for me personally. Yeah. And so, you know, to be able to hopefully find a place to live without being on a waiting list for 3 or 4 years.
Yes.
It's crazy. And then it's hard because every place has its own application and its own stuff. It's pretty crazy to try to navigate. So I don't know if there eventually can be something that could, you know, bring that down better, but maybe just going to Housing Resources Bainbridge would be helpful. I don't know, but I'm just putting it out there. It's crazy. Yeah, it's crazy.
Yeah.
So that's something for you guys. Another thing for you guys for your plate that's already, you know, way full.
Well, it's definitely a priority. So.
Right.
And I should add that although they aren't listed in that list, I know Helpline is also focused on trying to help with rent relief, and it's obviously something the city council is focused on, though the solution is not, you know, crystal clear. But I would say that if you were to look at that 12%, that means that a lot of people recognize it's a problem.
Exactly. And we do have Helpline House under cost of living because they deal with sort of across the board services to help support folks who might be having trouble affording cost of living.
Oh, thank you.
Thank you. So when you look at our nonprofits specifically, we could definitely give more examples. of some of the work that all of them are doing to help address some of these issues. But we also took a look in the survey at the health of our nonprofits, and we've been doing that since the beginning of COVID to get a sense of how nonprofits are being affected by the pandemic. And when we broke down the answers here, there was a question of, how strong are you compared to how you were before COVID? And strong, I will preface this by saying, can be defined in a lot of different ways. I think some nonprofits said they were stronger, not because of financial strength, but because they had a chance during COVID to reflect on organizational priorities. They were able to provide hybrid services that reaches more people than they could before. So nonprofits are definitely answering the question differently depending on what their perspective is. All nonprofits faced challenges, so this is not to say that this is, had a positive effect on nonprofits. I think this is just a perspective of we were able to be resilient during this time of crisis. And so, so for the environment, recreation, animal welfare, they, the majority of those nonprofits reported that they were stronger than before COVID, with some saying they were not as strong. But those were saying they were stronger because, for example, some environment nonprofits said that there was a new focus on the environment, a new focus on nature, a new focus on having public access to land, and animal welfare. And they might have said, our demand is increased. People need, animals for company during social isolation. They might have seen that as a strength. Whereas you see education, kind of where the majority of nonprofits said that they were not as strong, or at least less than, they're not as strong as they were before COVID. A lot of them reported it had to do with the shutdowns of the school and students, dealing with mental health concerns. So there were a lot of areas that it makes sense that they may have felt that they were not as strong as they were pre-COVID. And when you look specifically at health, housing, and human services, and I added this, I provided data specifically on the sector because I know senior center falls into this category. But 44% so not even half, but 44% said that they were stronger than they were before COVID. 33% said they were about the same as they were before COVID, and then 22% said they were not as strong as they were before COVID. Only 2% said not as strong, but that's still a pretty big number, even though these numbers are positive. We always need to remember that may not be categorizing themselves that way.
Yeah, and I would say in regards to the senior center that our membership has grown, that our activities have grown, and that we've been able to raise money for sure to support those things. But the other thing is that there's a recognition that the need for the services that we provide has grown. So I do think that the center is stronger than it was 3 years ago, but the identified need is also greater. So, onward.
Complicated one to answer, right? It's hard to quantify it, I suppose, when there's some good things and some things that are going to make it harder. So thank you for sharing that. It's a good example. And then when you look at priorities, we asked sort of what the top operational priorities are for nonprofits, and then the top training priorities. You can see here what the top operational priorities are. I won't list them out, but I will mention the training priorities because the top 4 in the health, housing, and human services sector were communications and marketing, fundraising, and specifically advanced fundraising, diversity, equity, and inclusion, and board development and governance. And we are offering trainings we're offering 3 trainings this fall and winter, and then hopefully some programs next year to address all of these top 4. And this pretty much mirrors most other sectors as well, these top 4. So that's our way of hopefully at least getting the ball rolling on some of these trainings for nonprofits, and they'll be offered for free to nonprofits. So
any questions about those? It makes sense to everybody on the call?
Happy to answer. And then I think I pulled this one up already, a couple of examples of, programs that we've supported in the past. I won't need to read those out. Funding sources are in 2021 compared to 2020. These are sort of interesting. I think most nonprofits did see a total revenue increase. If some by a lot, not some, not so much, but overall an increase, 2021 compared to 2020. So that's a positive thing. But in this specific sector, program service revenue was down and public foundation funding was down, which was sort of an interesting finding. And when you talk a little bit about human resources, kind of what resources do nonprofits have to even do this work, this great work that they're all doing, you can see here that there's some challenges around volunteers, and this has been across the board. This number is not unique to this sector. I think in some sectors it's even higher, that since compared to pre-COVID numbers, health, housing, and human services and public benefit are down 64% in terms of the number of volunteers, 24% same number, and 12% more. And 92% of the sector's nonprofits reported they rely on word of mouth as one of the top 3 ways they advertise volunteer opportunities. So one of the ways that BCF is trying to address this is to provide a Facebook page, which kind of acts, for those of you who may follow, like work on Bainbridge or Bainbridge sitters, essentially where nonprofits can post their volunteer opportunities, and then volunteers are part of that page and they can connect and hopefully make a match. So far, there hasn't really been a resource or a tool like that, and so we're hoping, it's a bit of an experiment, but we're hoping that as people join in and start to see some of the volunteer opportunities, that nonprofits will see their volunteers grow. So
I would also say, as someone who tries to work to recruit volunteers, one of the biggest challenges for us is to frame the opportunities, the jobs that we need help with, in a way that are that work well for both the organization and for the volunteer.
Yeah.
I know that one of the things that I love about IVC is that they have this idea of no guilt volunteering, where basically they throw out some jobs for people who are already registered as volunteers that they could do, and they can grab that and respond to that if it's interesting to them. And they don't need to respond if this week is not a good week to help. They just kind of don't have to respond. So it's something that I'm thinking about how other organizations. One of the challenges, of course, is for many volunteers, you want them to be able to be there every Thursday at 2:00 or for 4 hours a day, once a week. And those might be a little harder sell.
Yeah, and those are all good points. And I think meeting those challenges and this variety of needs is probably one of the harder parts of this. But hopefully the Facebook page will help connect people. And then, so when you look at the nonprofit staff, I think we provided sort of the overview of these numbers in a previous slide, and it's earlier in the report, that 17% of nonprofits in this sector are able to pay nonprofit staff $64,190 in salaries or more per year. So I think that's a challenge, given that a lot of people working in the community in these nonprofits are also running into challenges making ends meet themselves. And I think that's something we heard both in the survey. This is sort of a quantitative way of looking at it, but we heard about it in our conversations with nonprofits as well, is that it's getting harder and harder to maintain their own lives and working very long hours. So imagine the stress related to that. So in addition to that, 4% of nonprofits in the sector are able to provide health insurance to all employees. Can
I pop in again?
Please, Reed, help.
So we don't pay most of our employees that amount of money, and we have just this year started a health benefit, but it's like $1,200 a year which is not very much in the health industry, but it is at least a bit of an outreach to try to recognize that there are costs like that. And one of the challenges from the point of view of the nonprofits is it is hard to get people who are willing to donate for the sort of nuts and bolts of paying salaries. That is not quite as interesting as programs that don't, we're willing to pay 10% of overhead costs for a project that we're in love with, which the projects are good, but they are usually run by individuals who have to pay the rent.
Yeah, thank you for sharing that, Reed. I think that's the big takeaway too when we talk to other nonprofits, that's really the challenge. And I think the concern around that is that, we have this vibrant, wonderful nonprofit sector working incredibly hard to ensure equal access to the quality of life we all enjoy here. And this is starting to happen as cost of living and affordability is, as cost of living is going up and affordability is getting harder. These numbers are going to make it harder for the nonprofits to find quality, staff who can stay in the community. So I think that's the message we've been hearing over and over.
Could I ask something? Since your group, Dana, is much more sophisticated in terms of financial investments and whatnot, could they understand that how important that kind of support is for all the nonprofits and maybe have a better sort of, they're more tappable, more reachable, more, able, to maybe make a designated fund for what I forget what the word, there's a word for what you call that, but anyway.
General operations or?
There, yeah, okay.
General operations, yeah.
Yeah, which sounds like ho-hum, who
right, exactly. The general accounting office, please.
Fix the screen door, that really is a drag, but it's so vital. I don't know how to, but it seems to me the group there it understands the need for that and the value of donating to that. Or better yet, how about we just assess them a little bit of every part of what they donate needs to go to that sustainability because you can't have a house if you don't have a roof,
Yep. Points well taken.
Yeah, it would be an interesting kind of donor education effort by BCF.
Yeah. Yeah. Yeah.
Thank you for smoothing that out, Reed.
I think what I do think is this is identifying this as a need as a starting point, and I think that's where we're going to start, and we'll see what evolves.
Thank you.
Yeah, thank you for mentioning that. And then I think the final point here is the rest of the report. If folks are interested, these are the other 3 sectors. We did the same analysis that I just gave you for health, housing, and human resources for all of the following sectors. So arts, culture, and humanities, education, and then environment, recreation, and animal welfare. And I know there's some overlap. With some of these nonprofits and working with seniors, the animal programs of
Pause.
Thank you. Pause, and the animals they provide for some of the seniors. I love that program. I think that the way that they help us, match animals in need with people in need and are able to provide that support is a big part of the isolation piece as well. So there are a lot of nonprofits that are sort of, even though they are doing different work and have perhaps a slightly different mission, they might have overlap with some of the challenges that we identified.
Yeah, Bainbridge Island Museum of Art does a Look Again program to curate for people with memory issues. And we also know that Bainbridge Arts and Crafts comes to communities, including the Bainbridge Island Senior Community Center, and runs programs with working artists to do arts and crafts. And I don't know whether BYS is probably human services, but we're grateful for the education we get from BYS Youth for the Silver Tech training, where they come on occasional Mondays and help with tech issues with seniors. So that's technically about tech, but it also involves a lot of cross-generational value that goes both directions.
Yeah, and I will say the partnerships in this community are really fantastic. The way that nonprofits connect with each other and see opportunities that they can really help support the community together I personally, I mean, I grew up in a different type of community, and it's really special here to have that. So
I want to thank you very much. Are there any last points?
Other questions? Or there were some really great points brought up, so I wanted to thank everybody for chiming in, and I took note of all of them. So thank you.
Thank you for your time. And again, if you are interested in getting a physical copy of the report, or I'm guessing if you just like a PDF version, Dana, D-A-N-A, at bainbridgecf.org.
And I just put it in the chat. I know it disappears once we close the program, but
if you come to this later, it'll be in the information guideline, or the information right below the video in YouTube.
Great. Perfect.